phase, the athlete's shoulders flex, elbow and ankle flex, increase, hip and knees extend, and ankle plantar flexes, as well as all muscle actions are concentric. At the shoulder, the deltoid, the pec major flexes the arm. At the elbow, the triceps brachii extends the arm. At the wrist, the extensor carpi radialis and ulnar extends the radial carpal joints. At the knuckle, the flexor digitorum flexes the fingers. At the core, the erector spinae, the rectus abdominis, and the transverse abdominals extend the trunk. At the hip, the hamstrings, the glute, and the abductor magnus extends the thighs. At the knee, the quadricep extends the legs. At the ankle, the peroneus longus, gastrocnemius, soleus, tibialis posterior, flexor digitorum, plantar flexes the foot and flexes the toes. And then we're looking at phase 2, which is the takeoff phase, where our athlete is now in the air, jumping. The athlete takes off the ground, both hips extend, the knees are flexed, ankles are plantar flexed. The right shoulder rotates posteriorly upward and abducts, and the elbow is flexed, and the wrist and fingers are extended. The left arm at the shoulder is flexed, and the elbow is extended, and the fingers and the wrist are extended as well. All muscle actions again are concentric. At the right arm, the shoulder, the serratius anterior abducts and rotates the scapula upward. The teres and the rhomboids rotate upwards and moves the scapula medially and downwards. At the elbow, the biceps brachialis and brachioradialis flexes the arms. At the wrist, the extensor carporadialis and the ulnus extends the hands. At the knuckle, the extensor digitorum extends the fingers. At the left shoulder, the deltoid, the pec major flexes the arms. At the elbow, the triceps brachii extends the arms. At the wrist, the extensor carporadialis and the ulnar extends the wrist. At the knuckle, the flexor digitorum flexes the fingers. At the core, the latissimus dorsi and the rectus spinae posteriorly increases the angle extension at the trunk. The glutes and abductor magnus extends the thighs. At the hip, at the knee, the hamstring flexes the leg at the knee joint. And then at the ankle, the peroneus longus, gastrocnemius, soleus, tibialis, posterior flexor digitorum, and plantar flexion flexes the foot. And then the last phase is the contact phase, or the movement phase, where the ball is actually hitting right there. While in the air, the athlete extends his hips and his knees. The dorsi foot flexed on the right side, he abducts, and his right shoulder is forward, downward, and medially extends. At the elbow and flexes the wrist and the fingers. And the left arm, he abducts and extends the left shoulder backwards as he flexes his elbow, and while his wrist and fingers are in neutral position. Most of this action, again, is in concentric. His right arm at the shoulder, the pectoralis major, his pectoralis major rotates the shoulder laterally and forward. The levator scapula rotates the scapula downward. The subscapularis rotates the arm medially. The teres major and minor and latoris disami abducts the arms. The triceps brachii extends the arm at the elbow. The flexor carporadialis and ulnus flexes the wrist. The flexor digitoris flexes the fingers. And then at the left arm, the shoulder, the pectoralis major and serratus anterior rotates the scapula laterally forward. Levator scapula rotates the shoulder downward. The subscapularis rotates the arm medially. The teres major and minor latissimus dorsi abducts the arm. Biceps brachialis and radialis flexes the arm at the elbow. The radiocarpal and metatarsal phalange joints are in neutral position. At the core, the rectus abdominis, internal and external obliques flex, compressing the abdominals. At the hip, the hamstring, the glute maximus, and abductor magnus extends the thighs. At the knee, the quadricep extends the leg. At the ankle, the tibialis anterior and the extensor digitorum longus dorsi flexes the foot. And then at the end, this is where the athlete goes phase 1 here, phase 2 jumping, getting ready to explode. Phase 3 is getting ready here, extends the body and externally rotates, hits the ball, and now lands in recovery phase, getting ready to do it again. Thank you and have a great day.